As a government, and then, we have been really concerned about the outbreak of this coronavirus, which has been designated as COVID-19 in China. And we have put in place elaborate measures to ensure that there is no importation of this virus into the country. And we wish to state here categorically that to date, there has been no confirmed case in the country. We wish as government to assure the public the degree of preparedness is at the highest level possible and that there should be no cause for panic. Continuous surveillance, monitoring and screening has been heightened on all entry and exit points and all health facilities and communities. So all measures have been put in place to ensure that we are in control and we are in a good place. There is no point to panic. There is no need to worry. As government and as a country, we are on top of this. But again, we must also appreciate that we are part of the global system, and therefore events that are taking place in one part of the world certainly will impact on us as a country. And therefore it is important every time to take note and to monitor events as they unfold in other parts of the country so that we are not caught unawares. And therefore at this point I would like now to update you on the global situation in as far as this coronavirus is concerned, because we have been monitoring very, very closely events as they happen in other parts of the world. As of yesterday, as of 18th February, the number of confirmed cases was 73,332, and the deaths so far, as of 18th, were 1,870. Majority, of course, are from mainland China. In the African continent, there's been one case that has been reported in Egypt. But also wish to state here that the rate of transmission, according to the Ministry of Health from China, has reduced drastically since the virus hit Hubei following lockdown measures and that have been imposed on several cities in China to curb transmission of the virus. So what are the intervention measures that we have put in place ourselves as a country? And first of all, it is important for us to appreciate that this is not an issue that touches on Ministry of Health alone. It has got so many facets to it, and therefore to deal with those other facets, the government has been able to put together a multi-agency approach to this. And therefore there's a team that brings together various ministry departments to look into strategies on how to address this coronavirus issue. And therefore, from a government point of view, we are approaching it from a multi-agency concept, not an individual ministry concept. And that explains really why we have Mr. Gogo from Kenya Airport Authority and also Dr. Patrick from the, from the Ministry of Health. As a government, we already have a national contingency plan to guide the implementation of priority, preparedness, and response activities in view of potential threat posed by the potential for importation of this virus into Kenya. And therefore, we have a national contingency plan that has been put in place, and a contingency plan would mean that if there is need, all we need to do is not go back to the drawing board, but just to bring up that plan and implement it. So, and that's what I'm saying, that we are in a good place. There is no point to worry. We are in control of every situation. The government is fully prepared with the necessary facilities to be able to deal with any danger that might arise. We also have activation of emergency operation centers that is closely monitoring the evolution of the outbreak in China and the rest of the world. So there is a center whose role is just to look at what is happening, in the rest of in the world. Additionally, we have trained response teams that are on standby to investigate and alert in the country, any alert in the country. Further to that, we have in-country diagnostic capacity at the National Influenza Center and Kemri laboratories to test suspected cases of the virus. What that simply means that we are now able to test those, any sign of infection here in the country. Unlike before, in the early days during which we are taking samples out of the country. Now that does not happen anymore. So you can see we've actually been able to upscale our capacity in as far as dealing with this situation is concerned. So the period between the time the sample is given out and the time the test results are brought back is at the very most 48 hours. And that is a major, major improvement. We have also undertaken mandatory screening at all points of entry to minimize the risk of importation of the virus from affected countries. So we have in total 34 entry and exit points, and all of them are manned. So there is no way anybody is going to enter into the country without being screened. Additionally, we have been able to sensitize health workers in both public and private health facilities and at point of entry on how to deal with suspected cases. So all those people we see at our point of entry have been trained on how to be able to handle any suspected case. Additionally, health workers have been deployed at Jomo Kenyatta International Airport. That is our busiest airport, so we've got a lot more personnel there than these other airports, or these other ports in the country. But certainly we've never forgotten our seaport at the Port of Mombasa. We have also a similar team deployed there to ensure that nobody is coming in to the country that will get into the country without being screened. We have also established isolation facilities that have been set up at Kenyatta National Hospital and Bagathi District Hospital to be used to isolate suspected cases. There have been consultations with private health facilities within Nairobi County or Nairobi City to support provision of additional isolation facilities in the event that the country needs that. Beyond that, we also have procured additional 5,000 personal protective equipment with support from USAID. Because, you need the gloves, you need the masks, all the necessary support equipment. You already have 5,000, that have been procured to aid in that direction. But I think, and as a government, we believe that preventive measures are also equally very critical. Then how do we ensure that our public can be able, to prevent themselves from, acquiring the virus? What are the measures they must put in place to help them be able to, keep safe from this? So one of the measures is to maintain basic hand and respiratory hygiene and safe food practices. Simple, basic: wash your hands, wash your food. If you're eating any fruit, ensure that it is washed before you are able to consume it. Just normal, basic hygiene practices. The other measure is to avoid close contact with people suffering from acute respiratory infections. This would mean this person could be your child. It could be your significant other. So in the event that you notice that, then you rush that person to the nearest health facility, and then they'll be able to advise appropriately. In addition, anyone showing signs of respiratory illness such as fever, coughing, difficulty in breathing, and sneezing with a history of recent travel to China is advised to go to the nearest health facility for assessment and prompt management. We are also advising to avoid non-essential travel to the affected countries. We have mentioned also WHO, we've talked about USAID, and therefore, in order for any government to effectively deal with this situation that we are preparing for, it is important to collaborate with other agencies. And as government, we have been in very close consultation with the Chinese embassy here in Nairobi. We have also been in close contact with our embassy in China for daily updates on situation in the country. Through our mission in Beijing, we are in contact with the Kenyan students in Wuhan and have managed to secure medical services to those in need. And I wish to state here, and the doctor will confirm this later on, that we are aware that there are 2 Kenyans who are expectant. It was highlighted recently on one of the media houses that they have not been able to get any medical assistance. That is not true. I can confirm here that the embassy, the government through our embassy in Beijing was able to secure medical services to these 2 Kenyans, and they were given necessary support, and they are in good health. And therefore, some of the things that we hear on either media houses or maybe online, most of them are not true. And therefore, it is important, really, that before any story is carried, it's always important to check back. We are aware that there are a lot of sensationalization of things, events, and activities coming from China. As a government, you're aware about this, right? And before you carry out anything in a reputable media house, it is incumbent upon you to be able to check back with the government. The doctor is here. I am here. If you cannot reach any of us, certainly, and that is, that would be really, really an impossibility. If the doctor is not available, there will be somebody else who will be able to assist. If I'm not available, certainly there will be somebody who is able to assist. So for you to be credible, and especially when there are issues, again, of geopolitics, it is important to check back some of these, online videos that sometimes bring a lot of, panic, to the general public. We are also working very